The factors that a patient has control of that can control the success of their surgery is preoperative strengthening and adherence to a rigorous therapy program postoperatively. They have to be committed to therapy. They will be weaker after surgery, and that strength will not come back magically. They have to work hard at it.
The main goals of physical therapy following an ACL repair are primarily and first and foremost to get the extension back in the knee, which is what we call the ability to straighten out the knee. We have a 4 to 6 week window for that before scar tissue forms, and that becomes a trouble point. So if we can get that right away, which usually is not a problem, then we're in really good shape. Then after that is trying to get the range of motion or the bending of the knee, getting the swelling down, and then getting the person to walk with a normal walking pattern. Because even though it seems common and easy, that's one of the biggest challenges. People say, well, I have to teach myself how to walk again. This is crazy, but it is the number one thing we have to get into. After that, then we progress into strengthening, obviously, and then working on balance and return to activity, whether it's sports or work or just day-to-day life. Ideally, you'd like to get as much of the motion back in the first 2 to 3 weeks. Especially extension, you have a 4 to 6 week window where you can get the straightening. If you don't, at that point, your body starts to build up enough scar tissue that becomes difficult. And extension is the number one priority post-ACL. Because if you get that, you can get a normalized walking, you can get the quad to contract well, so it works out really well that way. Okay, so one of the key things we need to work with on you is balance now. Okay, as we talked about before, when the ACL is torn, the balance fibers leave with it, okay? So now when we get the graft in, we're trying to retrain you how to balance again, okay? The first thing you're gonna do is just balance simply on the one leg, okay? So just go ahead and balance. Knee flex. Your job is to keep your knee lined up over your toe, just like that, okay? And control it. Stay up tall and stomach strong, okay? Second thing you're gonna need to do is just kick back and forth like you're kicking a soccer ball. One of the key things in regards to ACL rehab is working on proprioception. Proprioception is our fancy term for balance. Your ACL has proprioceptive fibers on it which help tell the body where the knee is in space. And so when it's torn, those fibers get torn with it. So when they put in a new graft, we're trying to retrain the body how to identify where the knee is with certain dynamic movements. Such as balancing on one foot, something as simple as balancing on that one foot while you go to lift up a child, balancing on that one foot while you go to kick a soccer ball, more dynamic activities with athletics. So we try to build a progression for that. At a higher level, when you're going to return someone back to sports or a higher end job that requires a lot of physical activity, the next thing we work on is movement mechanics. Teaching people how to plant and pivot effectively without favoring that leg, but in a way that's going to keep the leg safe. We teach them how to land properly, landing with the knees bent and flexed and on balance. So we do a lot of drills to try to work them toward that, from very benign and basic, just jumping and landing correctly, to more functional ones where they're actually performing an movement within their sport. One of the nice things about being in coordinated health is our physicians will send over what we call a surgical map with their patients that allows us, when we first evaluate the patient, to see what was actually done in the surgery. In addition to the ACL, did the patient have any meniscus tears or cartilage damage that may slow or change how we address the progress from there. And again, we also will look at using golden rods, which is what we call our physician communication, which are letters over to the physician to let them know how the patient is doing in therapy. First of all, in the first 6 to 8 weeks, we're looking actually for the bone to fill in around the graft so that you get the double fixation in that position. Secondly, then we're looking for the blood supply to the graft, because the graft wasn't originally in that place in the beginning, so it's got to get a blood flow to it in that position. So those are all key components for us to allow someone to return to sports. Obviously, our side of it's nice in that we worry about strength and balance, and those things you can visually see. The hard thing, I think, for most patients is they can't see that other part, and that's the key things for us. Because even if they have the strength, if those other parts aren't in place, that graft will fail. And that's obviously what we don't want. We want this to be a one-time thing, and that's it.
An ACL tear is unexpected and season-ending. Your recovery process can take 6 months to a year, depending on your sport or activity level. Now, while it may end your season, it does not have to end your career. There are several steps that you can take to protect your repair and prevent re-tears in the future. Once you complete rehab after this ACL reconstruction and you resume your normal activities, it's important to use what we call a functional ACL brace. This brace will help support the knee and provide a little additional stability as you resume your work activities, as you go back to sport. Continue to perform those stretching and strengthening exercises and gradually resume your normal activities. Take it little at a time. After you finish physical therapy, I think you should start a sport-specific training program. This can jumpstart your transition back to your sport and try to get you back to that previous competitive level as quickly as possible. You've got to work consistently on your strength, your agility, and your balance, and this will help you regain that full function of your knee. And that's the art of medicine.